we'll start with the gum massage. The gum massage, Shira loves this because I think it relieves a lot of pressure in her gums. And this is why you really need to have, it tickles? Do you like it? So we take our finger, I use my index finger and I've cut my nails nice and short. We put them on her gums. As you can see, here, there's her gums. And I'm rubbing her all the way around. 1, 2, 3. And I'm rubbing her gums from front to back, stimulating them. The whole thing is to stimulate the face that's not being used. This I found there was drastic changes right away doing this with her teeth coming in and everything. And again on the bottom, 1, 2, 3. How did I do? How did I do, Shira? Thank you. Okay, so we did the lip stretch there. Or sorry, the gum massage. Now what we're going to do is the upper cheek stretch. So I have, going on the other side, it's a little bit more awkward, but I go into her mouth, and we're doing the upper cheek stretch again. So doing the upper cheek stretch, thumb on the forefinger, or I use my index finger, sweeping around and going up, and across, and down, and pulling the lip down. And this is just getting all those muscles to move and to fire. It hurts? Am I doing it too hard? Okay, I'll do it more gentle. And 3. And there we go. That's the upper lip. Now, we're going to do the bottom lip. It's always fun to try to... So let's do the bottom lip. So we're going to go thumb and forefinger, out, and around, and down, and up. Down, and around, and up. And after you do these, you'll create your own variations, but I'm just going by the book here. Up. And you want to do these like 3 times. The secret to having the motor oral therapy work is to do it on a consistent basis. And every day we do this. This is how we start our physio session. We do our CPT, then we do motor oral therapy, then we do our physiotherapy. So Shira likes her gums massage, so we'll do that again. 1, 2. It tickles. 3. And the lower jaw. 1, 2, 3. Good job. You're great. You're a champion. You're Simba. Oh, big Simba, not baby Simba? Okay. Now, we're going to do the resistive chewing. We have a few different tools we use. We use a Nook brush. It's the Nook brush, right, Shira? You see Nook? Shira loves her Nook brush. We also have a Z-Vibe. It's a mini vibrator. And we also have... Okay, where did I put the other vibrator, you monkey? Oh, here it is. And we also have a massager from Super Duper Inc. And this thing is great. We love it. A friend of ours told us about it, and all these other things as well. So, okay, resistive chewing. So, we want to use the Nook brush. We open up Shira's mouth, and we put the Nook brush right in there. Opens it up a bit, and you pulsate with 3 pulsations. It's hurting a little bit. Am I too far? How's that? Good? Okay. 1, 2, 3. We do this for 30 seconds. 2, 2, 3. 3, 2, 3. Shira's jaw is now way more open than it was when we started. When we started, I could barely get her jaw open. We've been doing this for about, 7 months now, 6, 7 months, maybe longer. And we started doing it, we learned off a video, and we started doing it before even meeting with our speech-language pathologist. The reason why you're pulsating, it's just to get things firing and let it know it's there. So that's 30 seconds. And you can see how much Shira can chew. Why don't you show us how you can chew? Chew on that thing. Good job. Wow, you're a good chewer. You're a great chewer. Okay. Can I give you a suction? Way to go, superstar. Okay. You are a superstar. Now let's just do the other side. Get that in there. 1, 2, 3. 2, 2, 3. So this is the resistive chewing part with the nook brush, right on the gum between the molars. And don't go too far too fast. We've been doing this for a while. Literally, we started just with mini steps, but it was the consistency that got Shira to be able to open her mouth so much. So you got to start slow and just be consistent. All right, good job. Now, we're going to work on Shira's tongue. So this is called lateral pressure to the tongue. They use a nook brush, but I use the vibrating Z-Vibe. So place the nook brush number 2 at the side of the middle of the tongue, and press quickly and firmly into the center of the mouth, pushing the tongue toward the opposite side of the mouth. Immediately move the brush back to the gum. Repeat 3 times. The third time, move the brush all the way into the cheek. Stretch it out. This movement should stimulate the tongue to move laterally over the teeth into the cheek. So,